3 types of food you need to eat to prevent bone loss and osteoporosis. Hi, I'm Dr. Megan, your prednisone pharmacist, and I'm here to talk about the types of food your body needs to support your bones. Now, the reason I mention this is because there are some risk factors for getting osteoporosis and progressive bone loss that you cannot control. And then there are some that you can control. And I want to focus on the ones you can control, especially when it comes on to what you eat today. And so first I'm going to talk about the things that are out of your control, and then I'll talk about the things that are in your control, especially your diet. So the risk factors for osteoporosis that you cannot control include the following. Your age. The older you get, the more likely to have bone loss. Being a woman, I know, women are more likely to have osteoporosis. A family history of osteoporosis. I personally have this. And so far, I don't have the age, but I've got the other two. A previous fracture. So if you've actually broken your wrist or your back or something, that's increased risk for further bone loss. Your ethnicity. White women and Asian women are more likely to have osteoporosis than other ethnicities. If a woman has gone through menopause or has had a surgical menopause from hysterectomy, that's more likely to cause osteoporosis. And if you have rheumatoid arthritis, a disease of inflammation, that in and of itself can increase your risk for osteoporosis. And then for men, if they are having issues with making their own hormones, which is called hypogonadism, then that testosterone loss can lead to increased risk for bone loss and osteoporosis. The final and most relevant to me as the prednisone pharmacist is use of steroids or glucocorticoids like prednisone, especially long-term, but even the first 3 months of steroid use causes the most bone loss percentage-wise. So those you can do nothing about, aside from get on as low a dose of prednisone as you possibly can. Here are some modifiable risk factors for prednisone, things that you can do. You can stop drinking alcohol. You can stop smoking. If you have a low body mass index, you can gain weight, to some muscle, get some fat to support your body. This is especially relevant in little teeny old ladies like my grandma who need the lean body weight of the muscle to help support the metabolism of the bones. Poor nutrition, not eating enough of certain things, can worsen bone loss. A low vitamin D level, which is called a vitamin D deficiency, and you can measure this using the 25D hydroxy vitamin D blood test. Eating disorders, insufficient exercise, low dietary calcium intake, and frequent falls. All of these, there are things you can do to improve your life. Like, for example, if you're more likely to fall, you can install handlebars in the bathrooms. You can use a walker. You can do strength training, things like that. The doctors who prescribe prednisone the most created a guideline all about osteoporosis because they don't want this permanent side effect to happen to anyone. And what they recommend people do include the following. Weight-bearing exercise. So lifting things, whether it's your own body weight or actual weightlifting itself, that helps your bones. Reduce your alcohol consumption is number 2. Smoking cessation if you can. Optimal vitamin D status through supplementation and sun exposure, because the sun is the very best way to get vitamin D. And then number 5, a healthy weight. We don't want to be too low and we don't want to be too high. We want to be just right with a BMI between 20 and 25. And so without further ado, let's introduce the 3 types of foods you need to prevent bone loss and osteoporosis. First, and I'm sure most people know this from the Got Milk campaigns, is calcium. Calcium is really important because it is the kind of bone building nutrient that you need to have proper bones. Things like prednisone and all of those other risk factors can decrease your absorption or the fact that you're even getting calcium at all. And so how much do you need? Recommended dietary allowance is somewhere between 1,000 and 1,300 milligrams per day, but you need to work with your doctor because It depends on your body size and other nutritional requirements like pregnancy. So, what are some good sources of calcium? Everybody knows milk, right? But it's not just dairy that has calcium in it. I'll mention the dairy though first. Yogurt, cheese, things like that. But there's also sardines, turnip greens, kale, salmon. So that was number 1, calcium. Number 2 is magnesium. And so many people forget this. It's so important. Calcium and magnesium live in balance with each other. When one goes too high, the other doesn't know what to do, and it gets the whole system out of whack. And you've got to be getting calcium and magnesium at a 2-to-1 ratio, actually. And standard American diet is incredibly deficient in magnesium. And so this one, it's really hard to get even if you're eating healthy. But here are the good sources of magnesium: kale, spinach, Swiss chard, pumpkin seeds, almonds, cashews, black beans, and dark chocolate. So the recommended daily allowance of magnesium is 310 milligrams to 420 milligrams. And so because magnesium is so hard to get in the normal diet, many people often supplement magnesium as well. And my favorite kind of magnesium is magnesium glycinate. It's really gentle on the stomach, and the glycine helps with your mood as well, because glycine is an amino acid that crosses the blood-brain barrier and goes to your brain and helps you feel calm and relaxed, which is especially awesome if you're taking prednisone. Number 3, final, most important type of food that you need to be eating to support your bones is protein. Now, why would that be? I thought the muscles were made of protein, right? Actually, your bones use protein as the lattice structure to connect the calcium, the magnesium, the vitamin D, vitamin K2, and other things that you need. There's collagen in there that's connecting all of those things. So if you're not eating a diet rich enough in protein, but you're eating all these other things, they don't have the lattice connector that they absolutely need. And so the recommended dietary intake is about 0.8 grams per kilogram of body weight. So a 130-pound woman is 60 kilograms. So that's 48 grams of protein a 60-kilogram woman would need to take. And good dietary sources of protein include animal meats like beef, chicken, turkey, lamb, bison, and then fish, shellfish, beans, other legumes, nuts, and seeds. And it's important you find a way to get all of the types of protein into your diet, because there are some amino acids that your body can't make from others, and you have to eat them. So if you're having any questions about this, reach out to a nutritionist, because it's really important that you get the exact amount of calcium, magnesium, and protein that your body needs to support your bones. And if you're wondering, a great source of not just calcium and magnesium, but also vitamin D and K2 and other essential nutrients for people taking prednisone, I personally didn't want to have to deal with complications of taking prednisone. And so I created a side effect supplement designed specifically for people on prednisone, and it's called Nutrinize Zone. Nutrinize is designed to reduce your suffering by replenishing your nutrients like calcium and vitamin D so that you can recover from taking prednisone. Whether you've been on it for years or just a few weeks, it's there for you so that your body can get back in the right balance of the things that prednisone has been taking away, like the calcium and the magnesium. It gives it back so that you don't have such horrible side effects while taking prednisone. You can just go to nutrinize.com, or you can find it on Amazon. Signing off as Dr. Megan, your prednisone pharmacist.